I'm Dr. Courtney Phillips. I'm board certified in addiction medicine and general psychiatry, and I'm the Vice President of Behavioral Health at the Healthcare District of Palm Beach County. Using medications as a tool as part of recovery is becoming a very important piece of someone's overall recovery. It takes a lot of things to get someone into recovery, not just medications, but medications are a wonderful tool that often assist stabilizing the acute brain pathology that's happening when someone's in active use and withdrawal, to stabilize them so that they're willing to receive the therapeutic services as well as the social services and the recovery supports that are offered to them. When someone's in active addiction, their brain is on fire. Their judgment is affected and their insight, and we know that that's actually a very biological process. It's not personal. It's very difficult for them always to accept AA or accept housing or accept help from other areas that they need help with. But when you add medications, it often stabilizes the withdrawal cycle that kind of puts their brain on fire. And that allows the person to be more receptive to all the other things that make them succeed long term. Medication-assisted treatment or medications for opiate use disorder or medications for alcohol use disorder, it really depends on the substance we're talking about. So let's talk about it in terms of opiate use disorder, where it has a very life-saving component. First of all, MAT, most of the medications for opiate use disorder actually prevent the likelihood of an overdose, and a fatal overdose at that. So that's a huge component. It helps keep people alive. That's Naltrexone, that's Vivitrol, that's Suboxone or buprenorphine. That's also Methadone. In any illness, not just addiction, medical illnesses too. Medicines are a necessary tool, but not the only or necessarily most important part in the toolbox. They're very important in saving someone's life and getting them to engage. But like any illness, you need to match medications with therapy. You need to match therapy with social determinants of health. If you don't have your hierarchy of needs met, and you're on medicine, it's still very hard to get better. So let's take opiate use disorders, for example. In traditional abstinence only, which means you get therapy, you get housing, you get all the social services, you get maybe psychiatric care if you have anxiety or depression or other things contributing to your opiate use, that really only 10 to 15% of patients are able to be successful with 30-day abstinence. When buprenorphine came out in the early 2000s as a real product, and methadone had been around since the 70s actually and shown tons and tons of success, it showed that when that was added to the picture of housing, other supports, recovery supports, that when you had the medication on board, you saw 50 to 60% success rate, and you see a lot more improvement in long-term recovery. It's a complex illness and it requires a complex team. But you also can't just have the social determinants of health or recovery only approaches available to the patient. As I said, for some people that works well, but there's a lot of people where they need that trauma work. They need that medication. Maybe they have an underlying mental illness. Maybe they have a medical problem. I can't tell you the number of patients that have chronic dental problems that drive their use. The point is this is a team sport, substance use disorder, and it requires multidisciplinary specialties in the social sector, housing, in the medical sector, in the psychiatric sector, and in the therapeutic sector, as well as the community. That doesn't mean that the 10 to 15% that were able to achieve abstinence only, good for them, they did it, but it's not a lot of people that can do that. The medication really helps stabilize the brain, it helps you prevent you from overdose, so if you use while you're on it, you're much safer, and it also makes them more successful at staying engaged with work, staying engaged with their treatment, staying engaged with mental health, and again, hearing that I do want to receive the help that's being offered to me through social services, through recovery residences, and through other mental health initiatives. Recovery is a spectrum. To me, medication is not replacing a drug with something. It means that the person is coming to a clinic, they're engaging with a team, they're talking about all the things that contributed to their use. When they relapse, they don't die, so we can learn from that relapse and help them readjust their plan. Whether someone stays on Suboxone for a year or 3 years or 5 years or indefinitely, they're in recovery. Treating someone with medications without having housing is a very difficult thing to do. Like I said, it's a complex illness and it requires housing, but housing also requires a stable person, and sometimes both are needed to work together. So I'm very happy to see this initiative that legislation is driving, that these two groups need to work together for the sake of the patient. Traditionally, there was a lot of judgment on patients who had MAT or MAOUD as part of their treatment plan. And I think that comes from a lot of misunderstanding and myths, which hopefully we're trying to address. But I think it requires the housing community to work closely with experts in addiction medicine, addiction psychiatry, as well as therapy experts to come up with behavioral management rules and regulations, because we just can't have it be a free-for-all either. So I think that the way to dispel these myths is to provide structure to housing residences and expertise in how they could appropriately manage and what expectations they could have for someone on MAT who also lives along someone who's abstinence-based, which is very possible, by the way. And I think there's a lot of great ways that we could achieve that through providing that training and structure to the housing recovery residents so that they're more comfortable supporting these patients who deserve the same treatment as somebody who's not on medications.